Sundowning refers to restlessness, agitation, irritability, or confusion that typically begins or worsens as daylight begins to fade, and can continue into the night, making it difficult for patients with dementia to sleep. Being overtired can increase late afternoon and early evening restlessness. Tips to manage sundowning are as follows. Take the resident outside or expose them to bright light in the morning to reset their circadian rhythm. Do not plan too many activities during the day. A full schedule can be overtiring. Make early evening a quiet time of day. Play soothing music or ask a family member or friend to call during this time. Close the curtains or blinds at dusk to minimize shadows and the confusion they may cause. Reduce noise, clutter, or the number of people in the room. Do not serve coffee, cola, or other drinks with caffeine late in the day. Aggressive behaviors may be verbal or physical. They can occur suddenly, with no apparent reason, or result from a frustrating situation. While aggression can be hard to cope with, understanding this is a symptom of dementia, and the person with dementia is not acting this way on purpose, can help caregivers respond. See the image above of a resident with dementia demonstrating aggressive verbal behavior. There are many therapeutic methods for a nurse or caregiver to initially respond to aggressive behaviors displayed by a person with dementia, as previously described in the Caring for Clients with Mental Health or Substance Use Disorders section. Communication, routine, empathy, redirect or reapproach. Aggression can be caused by many factors, including physical discomfort, environmental factors, and poor communication. If a person with dementia becomes aggressive, consider what might be contributing to the change in behavior and address it. Is the person able to let you know that they are experiencing physical pain? It is not uncommon for people with dementia to have urinary tract or other infections. Due to their loss of cognitive function, they are unable to articulate or identify the cause of physical discomfort and, therefore, may express it through physical aggression. Is the person tired because of inadequate rest or sleep? Is the person hungry or thirsty? Are medications causing side effects? Side effects are especially likely to occur when individuals are taking multiple medications for several health conditions. Is the person overstimulated by loud noises, an overactive environment, or physical clutter? Large crowds or being surrounded by unfamiliar people, even within one's own home, can be overstimulating for a person with dementia. Does the person feel lost? What time of day is the person most alert? Most people function better during a certain time of day. Typically, mornings are best. Consider the time of day when making appointments or scheduling activities. Choose a time when you know the person is most alert and best able to process new information or surroundings. Are your instructions simple and easy to understand? Use simple language. Limit choices to 1 or 2 options. Example, do you want to wear the blue shirt or the black shirt? Be sure communication techniques take sensory deficits into consideration. Try physically demonstrating instead of verbally instructing. Use pictures or gestures. Are you asking too many questions or making too many statements at once? Give ample time to process and respond. Is the person picking up on your own stress or irritability? Take a moment for deep breathing or ask another caregiver to assist if available. The following techniques are additional strategies that can be used with aggressive behavior. Begin by trying to identify the immediate cause of the behavior. Think about what happened right before the reaction that may have triggered the behavior. Rule out pain as the cause of the behavior. Pain can trigger aggressive behavior for a person with dementia. Focus on the person's feelings, not the facts. Look for the feelings behind the specific words or actions. Try not to get upset. Be positive and reassuring, and speak slowly in a soft tone, and seek help from another caregiver if needed. Limit distractions. Examine the person's surroundings and adapt them to avoid future triggers. Implement a relaxing activity. Try music, massage, or exercise to help soothe the person. Shift the focus to another activity. Redirect. The immediate situation or activity may have unintentionally caused the aggressive response, so try a different approach. Take a break if needed. If the person is in a safe environment and you are able, walk away and take a moment for emotions to cool. Ensure safety. Make sure you and the patient are safe. Be aware of movement of the patient's hands and feet, and protect yourself from being hit or kicked. Avoid potential strangulation hazards like retractable lanyards. If interventions do not successfully calm down an aggressive patient, seek assistance from other staff members. If it is an emergency situation, call 911 and be sure to tell the responders the person has dementia that is causing them to act aggressively.